Hi everyone. So today I will be doing my presentation on prevention of iron deficiency anemia in infants. Iron deficiency anemia worldwide affect about 30% of our populations. So it's the most common nutritional disorder nationwide. What is iron deficiency anemia? Iron deficiency anemia when there is a decline in concentration of the circulatory red blood cells and it's associated with impaired capacity to transport oxygen. In other words, when there is not enough oxygen to supply our red blood cells, there will be a decline in the hemo level. Iron deficiency anemia occurred when iron deficiency is severe enough to reduce the hemo level below the normal range, below 11 gram per deciliter. That's gonna, like a red flag could be your hemo level, it's depleted. What is the role of iron? Iron is very essential for brain development, immune function. It also play a role of synthesize collagen, serotonin, dopamine, and norepinephrine in infants' body. What is the consequence of iron deficiency anemia in infants? So consequence will be infants will have impaired cognitive development and learning disability. Also, they will have a delay in growth and behavior problems. Despite correction of iron deficiency anemia, infant will still scores low on cognitive and motor scale. The Bailey scales of infant development. It was designed to assess the development delay in infant with iron deficiency anemia. So, what the test actually measure? It measures behavior, mental, gross, fine motor skills in this infant, and the outcome of the assessment, where they found that infants with iron deficiency actually did scores low on cognitive, motor, and behavior. Um, so these infant scores very low on the assessment. Other study actually confirmed that iron deficiency anemia in infant are linked with cognitive, mental, and motor skills. Social economic has a huge impact on iron deficiency anemia. So they did study from middle class family and the lower income family. So what they found that infants from 9 to 12 months of age result in a lower HEB level. The hemoglobin level were actually 9.8 gram per deciliter. So infant from lower income family has low HEB, low hemoglobin. So social economic has a big impact again on infants anemia. Diet and other risk factor for iron deficiency anemia in infants. So if prematurity, excessive consumption of cow's milk, exclusive breastfeeding infant without iron supplement, risk factor, you're exposed to lead, underlying medical problems you could have as well, such as GI disorder, malabsorptions, inflammatory condition, all can actually trigger to iron deficiency anemia. To prevent iron deficiency anemia in infants, you use a diversified diet, iron rich complementary food. So this starts at 6 months, complementary food. It all depends on the baby head position wise. It depends on the physician, what they want to do. They do recommend that 6 months, but most places, the state wise, recommend solid food at 6 months. So you want to use dark leafy vegetable puree meats. You want to use tofu. You want to use fruits such as cantaloupe, strawberry, enhance iron absorption, or if they have any like iron source of made like vegetable, you drink a cup of orange juice, it will absorb the iron better. You want to provide daily fortified cereal with iron in it will actually be adequate in the diet. Restrict cow's milk until 1 year old because it's not recommended. And also you want to encourage adequate iron supplement at 4 months due to the insufficient iron in breast milk. Also, screening recommendation. Screening for iron deficiency for all infants recommend from 6 to 24 months of age. And you have the method of testing. You have a complete red blood count CBC. It's as simple as, and it's most effective and the cheapest, I would say. And then you want to do the mean corpuscular volume, and also you do the red blood cells weight, measure the variability in the red blood cell size. And a hemoglobin concentration is the only hemoglobin actually is going to measure the hemoglobin concentrations. And that's about it. If anyone have a question, you can either ask me in class or send me your question in my email. It's ushaikram@yahoo.com if you do have any questions about my presentation. Again, thank you for watching. Have a good one.